is still the #1 risk period for the development of eating disorders. So there's something about puberty and bodily changes associated with puberty and emergence of adulthood that still carry the highest risk in terms of the development of an eating disorder. And I put this graph up just to highlight a couple of things. So again, if you look at the pie chart here, you can see that the largest portions of this chart indicate an onset of illness between the ages of 11 and 20. So again, that pubertal, adolescent, and then early adulthood periods. And also another takeaway message here is the duration of the illness. So eating disorders can be chronic in nature or recurring very often. And these are expensive and very challenging illnesses to overcome, with a number of people still struggling with their eating disorder 11 to 15 years into it. So prevention is really, really important. Okay, so getting into some eating disorder prevention efforts. So I wanted to give you a bird's eye view of the kinds of things that are going on in eating disorder prevention. So the most widespread eating disorder prevention campaign in the US continues to be the Body Project. This is something that is run mostly through sororities and college campuses, and it tries to teach young women how to reduce body dissatisfaction, do things like eliminate fat talk, and the focus is on body esteem, body positivity. Another initiative in the States is STRIPED, the acronym STRIPED. This is something that grew out of Harvard University and the Boston Children's Hospital, and they train professionals in the prevention of eating disorders, also involved in some policy change. Closer to home, we have the Ontario Community Outreach Program for Eating Disorders, led by Gail McVeigh and her colleagues, and they do some really important advocacy work on the part of their organization with the government, both at the provincial and federal levels. And I want to put in a plug here for Beyond Images. This is a free online lesson plan that teachers can get, and it's a way of increasing media literacy for children grades 4 to 8. This can be used in the classroom. It's easy, it's free, it's engaging. The students love it, and teachers really like it too. You can get more information about how to get the Beyond Images program through the NEDIC website. And then lastly, school-based approaches. And so this is where our research starts to come in. NEDIC has been working hard for many years, going into schools, doing outreach, and you'll hear in a minute about the details of those kinds of prevention efforts. These school-based approaches continue to be very, very popular as a way to improve media literacy and spread the message of body positivity. Important to note that the #1 core feature of the eating disorders is still extreme weight or shape concern. And that's not to say that extreme weight or shape concern causes eating disorders, but it's a common feature to most, if not all, the vast majority of cases of eating disorders, and that's what we target in eating disorder prevention. A few current issues that I wanted to mention here as well. So for a while there was a myth that eating disorder prevention makes things worse. I think what that referred to is that kind of in the past, eating disorder prevention campaigns would teach students, young people, about the actual symptoms of the eating disorders. We know now that that's not effective, that can give people ideas about symptoms and ways to restrict food intake or try to lose weight. And nowadays, again, the vast majority of prevention campaigns are focused around body positivity, improving self-esteem, and decreasing body dissatisfaction. We also know that targeted intervention programs may be effective, that is, identifying people who are at the highest risk of an eating disorder. But for the most part, we still continue to do universal programs. And I think the thinking is a couple of things. One is that it's still very difficult to identify people who are at risk. We haven't come far enough where there's a blood test to say yes, this person is at high risk for developing anorexia nervosa. That may be coming down the road in a few years, but for now, what we do is we kind of take a broad-based approach, and we universally try to spread the messages that eating disorder prevention campaigns do. And there's also little risk. Almost everyone can benefit from these universal eating disorder prevention messages. I think it's still important to think about translating into public policy. So we can do all the work that we want to at an individual level or at a school level, but a lot of changes should and do come from public policy changes. And that is things like, restrictions on advertising, restrictions on the approval of certain weight loss products. We have to, trust our government to try to keep us safe. And that's what we should be pushing the government to do more and more of. In the past couple of years, I've been involved in a couple of research programs on eating disorder prevention. And so this year we published a study that was run a couple of years ago on young women's opinions of common eating disorder messages. And just a very brief summary of those results, we found that in general, women found eating disorder messages to be effective. That is, when they hear messages around body positivity, how important it is not to engage in fat talk and dieting and those kinds of things, those messages do resonate. And they have a differential effect on different kinds of people. One of the most important things is that the presenter of those messages be seen as being credible. And so that led into some of our thoughts around the current research project that we'll be presenting today. How can we increase the impact of a presenter on the audience of these eating disorder prevention messages? The audience, it would seem, is very sensitive to different kinds of presenters and feels that the audience feels that it's important to have a presenter who is seen as being highly credible. And then finally, we need to be more inclusive. Men and members of the LGBTQ+ community are too often neglected in research. And in this study, we tried to include a more diverse sample and specifically targeted male participants in our study and not just female participants. All right, so on that note, I will turn it over to Alyssa, who will talk more about the details of the current study.
Okay, so originally when we were developing this study, I was a volunteer with NEDIC, and one of the things that really stood out to me as a volunteer that made kind of NEDIC unique in a way was the fact that a lot of the volunteers at NEDIC who were presenting the eating disorder prevention messages also had lived experience with eating disorders themselves. And I was really curious as to how that would affect the message perceivability, but also how it would impact the audience that we were typically presenting to, which is the majority of time high school students. So in our current study, we developed a few research questions that we wanted to explore further. The first one was, how does presenter self-disclosure impact the students' ratings of message relevance, believability, and emotional impact? So here we're really looking at, how does self-disclosure impact the way that students are perceiving these messages, and also if they're believing the messages more or less, and also the type of impact they're having on not only their emotions, but their behaviors to diet, compare themselves to others, and other aspects of impact. So we also looked at if presenter self-disclosure decreased students' intention to diet and compare themselves to others. So this kind of ties in a little bit with the behavioral intention and how our eating disorder presentation impacted behavioral intention. In this gender neutral presentation, we were wondering if male participants would rate the messages and presenter the same as female participants. So NEDIC really makes every effort possible to make our presentations gender neutral. We do present to high school classrooms that have both males and females in them. And in that, we're including a lot more images that have males in them and including content that's more male relevant. So we were wondering, with NEDIC's efforts to make our presentations gender neutral, if males were feeling represented and if they would rate the messages and the presenter differently or the same as the female participants in the study. And then the last research question we had was if there would be an interaction effect between the gender and condition. So in that, we were really looking to see if gender and condition, so our condition was either the presenter self-disclosed or not, if there was any type of relationship between those two factors. So I'll go a little more into depth with the methodology so you can understand these questions a little better. So we took a community-based approach with this study, meaning that since NEDIC is a nonprofit organization that targets the community, we really wanted to emphasize that when we were coming up with a methodology for our study. And we also took a feminist focus to the study as well. And a common misconception with feminist focus is that we're only representing females, or we're looking at female issues only. But we were actually really curious about gender and the differences of gender when we are presenting to different populations and different audiences. So with a feminist focus, we were really focusing on gender equality. For recruitment, we contacted schools across Southern Ontario and offered free eating disorder presentations if their students could provide us with some feedback afterwards. So typically NEDIC collects donations and has the schools cover the travel costs for these presentations. However, in an effort to recruit and also to show our appreciation for student involvement in our study, we offered these presentations for free. So we contacted approximately 50 schools and ran into a few issues with recruitment. In that a lot of schools, either weren't interested in these messages or wanted more general presentations on mental health. But we did come and find 4 schools that were willing to participate and got our participants from those 4 schools. So looking at our participants, we had 75 participants in our experimental condition. So we had 75 participants who basically had the presenter disclose her history of having an eating disorder to them. And their mean age was around 16 to 17 years of age. And then in the control condition, we had 86 participants, and the presenter did not disclose to these participants. So the presenter therefore just indicated she was a NEDIC volunteer and a student in social work. The materials included in our study were the eating disorder prevention presentation. So with the help of Amanda, our amazing presenter, and NEDIC, we collaborated and made a presentation that would be representative of the types of presentations NEDIC would give to the high school population. We then included NEDIC-related content and made sure that the education outreach coordinator kind of approved this content so it was representative. In addition, we included a demographic questionnaire. So this questionnaire asked students their gender, their age, what grades they were in, and if they've ever had previous exposure to eating disorder prevention messages. We found most students typically had some types of exposure either through social media, internet, TV, and then as well in health class. But no students in our study received a NEDIC presentation in the past. And then as well, we included the 2 questionnaires that we based the majority of our results off of. So the first questionnaire was the message evaluation questionnaire, and this was taken from Dr. Mills and colleagues' previous study, where we looked at specific aspects of the message, and I'll pull that up in a second so you can see what the students had to answer. And then in addition, the presentation evaluation questionnaire. So this was looking at the presenter and then also questions around who these presentations should be targeting from the students' perspectives. And this was also derived from Dr. Mills and colleagues' previous study. So this was the message evaluation questionnaire that we gave to our students in the study. So items 1 through 10 were measured on a 5-point Likert scale, and then items 11 and 12 were open-ended questions allowing participants to elaborate specific details in the messages that they either liked or disliked. And then the final questions were then also coded on themes that we defined after we familiarized ourselves with the data. When looking at the presenter evaluation questions, items 1 through 4 were rated on a 5-point Likert scale, and then items 5 through 9 were multiple choice and fill-in-the-blank questions. So the final question we found was not completed by the majority of participants. However, it was coded using the same approach as the final items on the message evaluation questionnaire. So there were slight differences made to the presenter evaluation questionnaire from Dr. Mills and colleagues' previous study in an effort to put less emphasis on questions regarding the weight and appearance of the presenter, since this wasn't necessarily a variable we were looking to explore in our study, and it was potentially triggering for our presenter who has lived experience with an eating disorder. So when looking at the procedure or how we went through with the study, students were told by their teachers that NEDIC was coming in to do a presentation. Depending on the group that the classroom was randomly assigned to, Amanda, our presenter, either introduced herself as a NEDIC education and outreach volunteer who was also a student studying social work, or in our experimental condition, she introduced herself as a NEDIC education and outreach volunteer who's recovered from an eating disorder herself. So in that disclosure, she talked a little bit about her history of having an eating disorder and how it developed with simple restriction turned into full-blown, or a simple diet turned into full-blown restriction and eating disorder pathology. So she talked about how she is currently in remission and doing great, but you know, it was a struggle for a long time in her life. So the presentation for both groups was entirely the same with the exception of this beginning self-disclosure piece or the introduction that she gave. So there was also slight variations in the presentations based on student participation and the questions that students may have asked throughout. Once the presentation commenced, students were then asked to complete the questionnaires on the presentation independently. And after they were able to complete the questionnaires, they then we opened it up for questions around the study and kind of went over the debriefing letter so they knew kind of what the focus of our study was, and they were able to ask questions around that. And we also provided students with some resources so that if any of our content was triggering or if any of the content really had them realizing that maybe they are struggling with an eating pathology, that they could seek help either through NEDIC's hotline, the kids helpline, or a school guidance counselor. So the results we arrived to were quite interesting. Some matched a few of our hypotheses and others kind of contradicted it, which was very interesting to see. So to start off with, this is kind of a breakdown of our participant characteristics. So the majority of our participants were Caucasian or European, and consequently the sample was not as ethnically diverse as the composition of typical high school populations in Canada. And this was listed as a possible limitation for our research study and could just merely be based on the types of schools who were interested in the presentation and the locations of those schools. So few conditional differences were found on the message evaluation questionnaire, indicating that self-disclosure did not impact opinions on how important, believable, and convincing the messages were. And this was really, I guess, shocking for us because we assumed that, you know, if someone had self-disclosed, that maybe the message that was being delivered would be a little more believable or even more convincing, but we actually found slight differences. So nothing that was really significant at all. So no differences were found between conditions on the two items that inquired the students' ratings about how happy they were with their bodies, along with the likelihood that they were to worry about their weight. Upon investigating the ratings of how interesting the message was for participants, the students in the non-disclosure condition actually found the message to be significantly more interesting than those who received the disclosure. And this was a really interesting finding for us One explanation that previous research would kind of support is that because the presenter disclosed her personal history of having an eating disorder, the participants then found that the content was less relevant to their own lives, and consequently they rated the messages as less interesting. So we are curious as to if we had evaluated risk. So if those who were maybe at a higher risk or who had lived experience themselves with an eating disorder or a loved one who had an eating disorder would maybe find the message a little more interesting than those of a non-clinical population. However, due to ethical restraints or constraints, we really couldn't evaluate risk with this population, but it might be an area for future research to explore. Item 6 on our questionnaire, which looked into the understanding of the prevention messages, also showed that participants who received a disclosure understood the message better than those who were exposed to the presenter's eating disorder history. So basically here, research in education has previously indicated that self-disclosure deepens understanding about specific topics. However, the results of our study implied that self-disclosure in this context actually did the opposite. So this promotes the need for maybe further research to investigate if self-disclosure would be more relatable and interesting if messages were being delivered to a clinical or symptomatic population. And then another interesting finding our research conveyed was that when the presenter self-disclosed, students rated the likelihood to diet as less than those who received a non-disclosure from the presenter. So those students who were in the audience who received a disclosure about Amanda's previous history of an eating disorder actually rated themselves as being less likely to diet in the future than those who didn't receive the self-disclosure. So this suggests that when the presenter shared her eating disorder history, participants were less likely to engage in restrictive eating behaviors, and really, I guess, shows a need for maybe a longitudinal follow-up on this finding to see if or to explore if this motivation to diet has a lasting impact on participants. So moving on to some of the qualitative findings for the message evaluation, we found that about 46 participants who reported they did not like something about the message, so about 56%, reported that the presentation conveyed the message that one should not eat, or that the presentation conveyed the message that one should not eat healthy, go to the gym, or take care of their bodies. So this is actually based on the motto that NEDIC follows called HAZE, which is health at every size. And the idea here is that health shouldn't be determined by weight or shape, and that people of all different types of weight and shape can actually be healthy. So students reported that this was concerning as everyone should still try and be physically healthy and exercise regularly and eat healthy. So they actually found that this message or the HAZE motto that NEDIC followed was basically saying that you don't have to eat healthy, you don't have to exercise, and that you can just kind of be yourself and engage in any type of behaviors around food and exercise and still be healthy. So another participant who was female in grade 12 indicated that the presentation should not be promoting obesity. So this message of health at every size was conveyed that we were promoting people to be overweight and that it was okay to engage in unhealthy eating habits. So this was also misconstrued with the message for this population. Another noteworthy theme in the message evaluation questionnaire was that the presentation was not representative of all people. So 13% of the participants mentioned that the images within the presentation did not represent racial diversities, genders, and all shapes and sizes. So one female participant in grade 12 wrote that the women and men who were representative as fat were not actually fat. Another female participant in grade 12 reported that the presentation should represent males better as well. There were also several things that the participants in our study liked about the study. So of the 116 responses to this question, 21% mentioned that they liked the videos that were played during the presentation, and particularly liked the video on no body shame. One female participant in grade 12 reported that the last video was very powerful and really shed light on the fact that the person in the video had an illness that made her gain weight, but she didn't let her body determine what she could do. So another male participant indicated that despite being overweight, this person looked happy and healthy as well. So 18% of responses included in the message, or included that the message of body acceptance, which was presented throughout topics, was very powerful as well. And kind of contradictory to some of the dislikes, the health at every size motto was liked by about 12% of the participants. So despite the fact that this was also something that participants disliked, other participants used descriptors such as inspiring, uplifting, and influential when describing the NETIC, or the motto that NETIC endorses. One interesting finding on the message evaluation questionnaire was regarding the interaction effect between condition and gender. So we clustered items based on the content of the question and what the question was measuring. So items 4, 5, and 6 were clustered on our MANOVA analyses, and follow-up analyses on this interaction revealed that males understood the message significantly less when the presenter self-disclosed in comparison to females who showed no differences across conditions. So this was specifically exemplified in question number 6, so item 6 on this graph. So this illustrated that a ceiling effect occurred. So participants, females specifically, understood the messages better than males, and this lack of understanding from males intensified when the presenter self-disclosed about her eating disorder. When looking at some of the results we got from the ratings of the presenter evaluation, one unanticipated finding was that male students in the study rated the presenter as significantly more attractive in comparison to female students. Males also rated attractiveness to be significantly more important when delivering eating disorder prevention messages, which was interesting as females did not deem attractiveness to be important at all. So one explanation for this is that the message delivered to students in the study undermined the importance of stereotypical beauty ideals, and considering that females in the study understood and believed the messages a little better than males, these females were able to hopefully internalize some of these messages from the presentation, and in turn this persuaded their opinions of the importance of attractiveness when delivering eating disorder prevention messages. No significant differences were found in presenter ratings of credibility when comparing the responses of participants in the self-disclosure condition with participants in the controlled condition. So this is consistent with studies that have not found differences in credibility between mental health professionals and recovered patients. So both of these people are deemed as credible for delivering eating disorder messages. And since Amanda was a volunteer at NETIC for several years prior to this study, this may have deemed her as an expert in the eyes of our audience, and thus message or the credibility of her, whether she disclosed or not, was not impacted. Some qualitative findings for the presenter evaluation questionnaire was that participants, regardless of their own gender, preferred females to be delivering this message. So about 75% of our participants found that females would deliver this message more effectively in comparison to males, or both a female and male. 41% of our participants ranked someone who has recovered from an eating disorder would be the most effective in delivering eating disorder messages. And then a close second to this was a mental health professional, which is consistent with some of the research I previously discussed. And then 85% of students ranked the school to be the most appropriate place for eating disorder prevention messages to be delivered to, with community programs and parents being close seconds as well. And 62% of our students indicated that ages 10 to 25 would be the most appropriate to receive eating disorder prevention messages, with grades 7 through 12 being the most suitable for the messages in the presentation. So some conclusions that we derived from our study was that very few conditional differences were found with self-disclosure. And this was quite shocking for us, as we thought self-disclosure would show a bigger impact for either the presenter evaluation questionnaire or the message evaluation questionnaire. And we actually found very few conditional differences. So in that, it, I guess, poses some questions for future research to explore on if maybe a clinical population would benefit more from a presenter disclosing about her history of having an eating disorder, or if a different population or age group would maybe benefit more than the high school students in this presentation. One thing that we did find was self-disclosure does promote more audience involvement, especially with females. So when Amanda disclosed to our audience, they were more likely to participate and share their own experiences with body image, self-esteem, dieting, things like that. So there was a lot more involvement when Amanda disclosed than when she didn't. Males did not feel that the eating disorder prevention messages were relevant or important to them. And I think this is a concern for all prevention efforts, and also just for the eating disorder population and research in general, that males feel underrepresented in this field. So males did not feel that the eating disorder prevention messages were relevant or important to them. And this was not only conveyed in the results of the rating scales, but also the lack of participation by male audience members in our study. So we know from previous research that males historically have not benefited from eating disorder prevention messages. And this research we've done further supports this evidence, despite the effort of including more male relevant content throughout our presentation. A gender effect was present on majority of the items on the message evaluation questionnaire and the presenter questionnaire, reiterating the need for more research on what males would find helpful in eating disorder prevention efforts, as well as just representing male experiences more in prevention efforts. So another important finding or conclusion we made was that the health at every size motto was misunderstood and or was received or not received well with this age group. So this result was interesting, as several participants indicated that they disagreed that being overweight is healthy. And a noteworthy amount of participants also indicated that they liked this message. So this may also reflect the ongoing controversy in healthcare about weight not being a determinant of size, and also social trends about clean eating, fad diets, which emphasize thin ideals, are also the healthy ideals. Other conclusions that can be taken from this research is that when working particularly with high school students, interactive components in presentations are effective in keeping their attention and keeping them focused on content rather than other distractions. So students responded really well to the videos and graphics in this presentation, keeping their focus oriented to the messages being delivered over the course of the 45-minute presentation. So this result would be effective for all prevention efforts to utilize, as more students are focused on content, the more, and if they're more focused on the content, they'd be able to take away more from these prevention efforts. Since there's very limited research that has previously been done on self-disclosure, this is kind of just a pilot study in exploring self-disclosure in eating disorder prevention settings, and further research is mandated. Move on to Jennifer Mills.
Great. So some takeaway messages. So sometimes people, when I speak to people about eating disorders, eating disorder prevention, people want to know, how can I help? What can I do to try to dissuade the development of body dissatisfaction, extreme weight and shape concern, and disordered eating? So one of the things that we can do as adults, as parents, is to model healthy behaviors for children and adolescents, and that includes, you know, eating a wide variety of foods, everything in moderation, expressing enjoyment of food and not guilt or shame around eating certain types of food, provide an environment that makes it easy for people to make healthy choices, especially young people, having lots of fruits and vegetables available to kids. Um, I don't always agree with school-based approaches to insisting on healthy foods and shaming people for bringing what are so-called quote-unquote unhealthy foods to school. Nevertheless, we have to make sure that it's really easy, that those healthy foods are accessible to kids. And again, getting back to policy and the role of the government, making sure that people can afford to buy healthy foods. Focusing very little on weight and more on behaviors and overall health and well-being. So not insisting that children necessarily be weighed regularly. That's not necessarily a good indicator of health. It may be important to track growth and development, but it's you know, probably widely agreed that, you know, it's unnecessary for kids to be weighed at home. And especially adolescents, that's an age at which people can become very fixated on the number on the scale. So adults, parents, teachers, I think it's our role to teach kids how to question the necessity for that, and again, focus on behaviors and overall health. Provide a supportive environment with lots of listening and less talking. We know that kids don't like being lectured to, and kids like to feel as if they're coming to their own conclusions, they're forming their own opinions, and it's important for us to listen to them, even when we don't agree with them. And as Alyssa mentioned, one of the more discouraging, I guess, findings from this study was that some of the students rejected the Hayes model. They rejected this idea that you can be fat and fit, for example. And so that may be something that we don't necessarily agree with, but it's important to listen to that and to have an open dialogue about what our values are and what the evidence is for or against our beliefs. We welcome community input, listeners like yourselves today. We welcome input regarding eating disorder prevention. I know NEDIC constantly strives to improve upon evidence-based prevention practices, so we welcome input from teachers, mental health professionals, and young people themselves. If you have any ideas on how eating disorder prevention can and should be improved, please let us know. You can email me, and my email address is up there. You can contact NEDIC. And I'd like to acknowledge the support of NEDIC in this project, allowing us to, use their presenter and to use Alyssa and some of their other resources and going into the schools and running this research project. Amanda, who was our wonderful presenter, all of the students in the study who participated, and we are very grateful for financial support from the Women's College Hospital, something called the Women's Exchange 15K Challenge, which helps nonprofit organizations translate knowledge about women's health directly into the field. And so I see that there are some questions coming through, and so we will try to answer those questions now.
Any in particular? So we did have a question about the age group, which we clarified in the chat. So the question was the age group of the study participants, which we clarified as being high school students in grades 10 to 12 and over 16 years of age. Mm-hmm. Okay. I see someone typing, so I imagine we have a few other questions. If folks can hold on for just a second, we'll see what comes up. In the meantime, I really want to say thank you to Alyssa and Jennifer for coming in to do this webinar. I think it's been really informative, and we're really happy to learn about the results from this study. They're definitely long awaited for NEDIC as well, and we're excited to have them. Yeah.
Yeah, and
Thank
I'm really impressed at NETIC and NETIC's willingness to do this kind of program evaluation research. It requires kind of an open attitude, an open mind
you.
to really listening to the young people who are participants in these programs. And I think that is definitely going to help to continue to improve the impact of NETIC.
Mm-hmm. So we have some questions here. Okay, so we have an interesting question about the Hayes model. So if Hayes was targeted to younger folks, if it had been taught at a younger age, do we think that the results would have been different in terms of how they interpreted the information?
Hayes is, I'll be honest, Hayes is a bit of a tough sell to certain audiences. I mean, here, in this office and in the online extension of NETIC, it's something that we are accepting of. It's a tough sell for some individuals, and it's true that catching people earlier and introducing that concept of health at every size may be the way to go. Now, in our own results, the participants indicated that eating disorder prevention should be targeted anywhere from, I think the lowest age was age 10 and up. So, so that's coming from the participants themselves, that if you go too young, they may not have the attention to pay attention to the messages. They may not have the cognitive capacity to process those messages. But it's an interesting question, whether even just exposure to those kinds of messages from an earlier age might be helpful.
Yeah.
Did you want to add anything?
Yeah, and I think NETIC is doing a lot of great work going into even healthcare providers and explaining the Hayes model and explaining kind of our perception that weight shouldn't be the only thing that's indicative of health. And, I think there's a lot of misconception, even in the medical model, with weight being a huge determinant of health, and in that, moving away from maybe weight being the only determinant and exploring other determinants such as lifestyle and more balanced perspectives, I guess, on what health looks like. Okay. So we do have another question. So our question is, how can we begin to recruit male, Black, Indigenous people of color, and LGBTQ plus presenters to help provide representations and information to those who do not identify with the stereotypical white female population, which is often kind of the presenters that we have been seeing so far. Yeah, absolutely. And I want to provide some feedback on even just NETIC in general is so great with recruiting people of all ethnicities for their education outreach program. I know our team here is so ethnically diverse, and so the presenter in this study was Caucasian and female, but in the past we have had quite a ethnically diverse team here presenting these messages. And then in regards to males presenting the messages, that's something that's ongoing. We're always looking for male volunteers in the education outreach program here at NETIC to help build our team and give us a better perspective of the male experience. Oftentimes our volunteers are females, and it's been something that we've been really working towards, diversifying our team further and getting some male experience in here so that we can better represent males and so that our audience members feel represented as well.
Yeah, and I mentioned the Beyond Images program a little bit earlier. If you're listening today, or if you're listening to an archived version of this down the road, please do consider taking up that curriculum program, the Beyond Images program. That's for, I guess, mostly intended for teachers in the classroom, right? And so whether you're female, male, Black, white, anybody can do that. And that's a way to start making an impact at a very local level with your own classroom or with your own school, that sort of thing.
It looks like that. Oh, I see some more typing. We might have another question. Okay, that's a thank you for our presenters. So it looks like that's...
Yeah, there was one question around sharing the videos, and I think Nedic would be more than willing to do that. So if you want to either leave your email address or...
Yeah, so we do provide a link to all the registrants. We'll send a follow-up email with a link to the recording of the video, so that will be accessible to everyone.
Awesome.
Okay.
And the videos shown in the presentation can be provided too. They're accessible on YouTube and things like that as well.
Great. Okay. Thank you again so much to Jennifer and Alyssa, and thanks to everyone for tuning in. Have a good one.
Thanks.
Thanks, guys.